Welcome and thank you, everyone, for joining us for the special Afya Town Hall focused on the Ebola outbreak affecting communities in the Democratic Republic of Congo, DRC, and Uganda. So far, the World Health Organization reports there have been 234 deaths, 915 cases, and there are over 8,000 people in active contact tracing. As we start today, please leave any questions you have in the chat and we will try to get to them later. My name is Dr. Stephen Kelly, and I'm a family physician, 51 years in practice, and have volunteered with Afya since 2009. Today, we'll discuss the current Ebola outbreak, what healthcare workers are facing, and how Afya is helping protect frontline providers working under extremely challenging conditions. With us today are our key members of Afya's senior leadership team. Danielle Butin is founder and CEO of Afya. Heather Clark is the chief program officer at Afya, and David Bourns is the chief operating officer at Afya. In 2005, I partnered with a local medical provider in Uganda to build a primary care and maternity center in rural Kampala, Uganda. I've never forgotten the dedication of the healthcare workers and communities that I met there. When I heard about the current Ebola outbreak, I didn't think about the headlines. I think about the people I know and how urgently they need the protective equipment and resources that can save lives and help stop the spread of this terrible Ebola virus. At this time, I'd like to speak with Danielle. Let me just start. Many people know Afya as a humanitarian organization, but they may not fully understand the scope of your work. Can you tell us about Afya and how this mission began?
Well, first of all, thank you, Dr. Kelly, always. So let me start by taking you back almost 20 years ago to the Serengeti Plains one evening as the sun was setting. I was there on vacation and I noticed a woman alone in a tent crying. And I sat with her and asked quietly, "Are you okay?" And she looked at me and said, "I am not okay. I am the woman's health physician in London. I came here to do clinical work, to treat patients in community health clinics, but I can't. There are no supplies anywhere. I am watching people die, and I feel completely helpless here." And in that moment, there was absolutely nothing for me to say, but her pain and her feelings of injustice were palpable, and it cracked something open in me, and her story completely changed and launched mine. And I came home and I had to act on what I had heard there. And I saw the gap. There are communities around the world lacking basic medical resources, while here at home, life saving supplies were being thrown away every single day. I had had a career in healthcare and I knew about waste and waste management and healthcare practice, and I could not unsee the opportunity. So, almost 20 years ago, that was the birth of Afya, and Afya means health in Kiswahili. Our name honors the land that inspired this really beautiful work. Since then, Afya has rescued and shipped nearly $70 million worth of medical supplies to more than 90 nations. But I don't think numbers fully capture what this actually means. So it means a nurse in Eastern DRC has gloves. It means a midwife has supplies to safely deliver a woman in labor. It means a healthcare worker can safely do their job. Healthcare systems are most vulnerable during a crisis, whether that is a natural disaster, a conflict, epidemic, a humanitarian emergency, and access to basic healthcare supplies can really determine whether healthcare workers can continue serving their communities at all. And so, what drives everything we do is a simple belief that no healthcare worker should be forced to care for patients without the supplies they need to deliver the care or without the ability to remain safe.
So, Danielle, one thing that's always distinguished Afya is you don't just simply send supplies after a crisis occurs. You're building systems that allow rapid response. Why has this emergency response become such an important part of Afya's work? I'm thinking of what we did in Haiti. It was unbelievable how you got the supplies moved out and used every resource to do that.
I think you're right. I think the lack of bureaucracy of the work we do is enormously influential in everything that comes from Afya. So many of the health systems that we are already helping are under resourced. So way before a crisis hits, these health systems are in trouble. And you add a disaster on top of that, a flood, a conflict, an outbreak, and the system can collapse. I mean, almost overnight. And now what we're seeing with climate change is it's driving far more extreme weather related events, and urbanization is accelerating how fast infectious disease can spread. So we are now responding to, I'd say, 4 to 8 disasters every single year, sometimes simultaneously. As of late, the war in Ukraine, we're still responding in Ukraine. The LA wildfires, Hurricane Melissa in Jamaica, there is always a crisis somewhere now, and we are always moving. And I think the critical element here is that we listen. We ask sites what they need, and we ask for their wish list, and it dictates our response. We don't decide from New York what colleagues in the DRC or Uganda need. We ask, we listen, and we deliver, and we truly have their back in this process of acquiring needs through the inquiry and the needs assessment that we're doing with partners on the ground. During both our regular health system strengthening work and our disaster response work, we support the healthcare infrastructure of the site on the ground that's been impacted by showing up and remaining present. We do not parachute in with supplies and then leave. We fortify the system and the people who are already there doing the work. And our disaster response is often a far longer term engagement that lasts through recovery. And Afia believes in one worldwide community. What happens to a healthcare worker in DRC is not separate from all of us. We strive to truly live the maxim that we are all brothers and sisters, and borders don't stop viruses. We saw this with COVID. Our compassion should not stop at borders either. And so here's what makes me really proud is we can do this right from here, from New York. Our hospitals have surplus, our manufacturers have inventory, and our incredible community has heart, and Afia becomes the bridge. And unfortunately, Ebola, this time and back in 2014 in West Africa, is one of the clearest examples of why speed, trust, and supply chain matter so much.
Definitely. And could you just briefly tell us about the difference or how they're alike in terms of disaster response in the United States, as you did with COVID and other disasters, and the international disaster response, emergency disaster response?
The I'd say the biggest difference is the logistical piece that we're going to hear more from David on. It is far easier to deliver supplies within the United States during a disaster than the process of ensuring receipt of items that we are sending during an international crisis. So I think that is one of the biggest differences in this work, and we're going to get into much more detail around that when David starts to share what we've been doing so far.
Okay, great. Okay, I want to talk to Heather now. Heather, unfortunately, we're facing another Ebola emergency. Heather, you lead as of Afia's disaster and health development programs domestically and all over the world. Tell us what we need to know about this latest Ebola outbreak and why it's so worrying.
Thank you, Dr. Kelly, and thank you to all of our guests for joining today. Um, so the current outbreak involves the Bunjibujo strain of the Ebola virus. This was first confirmed in Ituri province in the Democratic Republic of Congo, or the DRC, in May. Uganda subsequently reported imported cases linked to the outbreak. So first I'm gonna show 3 slides to help situate us. The first slide is a map of the region affected. And the star represents where most cases are and where it is believed to have begun in Ituri province in the northeastern area of the DRC. And so far, cases have been reported in 33 health zones across Ituri, North Kivu, and South Kivu provinces in the DRC, as well as a few in Uganda. And as you can see, the DRC borders 9 different countries. And as we heard from Danielle, there's a lot of cross-border movement, which is posing a challenge for this particular outbreak. In the second slide, this shows Afya's operations. And so this is our warehouse. We have a few of our staff members preparing pallets to go. This was the Uganda shipment that already landed and also preparing shipment to go to the DRC. And our third slide, we have on the left, you can see this is a photo that was published in the New York Times of healthcare workers and individuals that are not properly suited up with the right PPE that would help prevent transmission of this strain of Ebola. And on the right, we have workers that are in the proper gear as per the WHO. So the WHO has declared this outbreak a public health emergency of international concern because of the cross-border spread, healthcare system vulnerabilities, and the absence of licensed medical countermeasures such as vaccines or treatments. And as the WHO's, as of their latest update on June 19th, we heard Dr. Kelly mention that there have been a total of 915 confirmed cases, 896 in the DRC and 19 in Uganda, a total of 234 deaths, 232 of those in the DRC and 2 deaths in Uganda. But it's really important to note that these figures are changing rapidly. They are changing day to day, and the numbers are predicted to be actually much higher than what we have confirmed. So based on past outbreaks of this particular strain, there is a 25 to 50% case fatality rate. And unlike the more common Zaire strain, there's currently no licensed vaccine and no approved specific treatment. And a lot of effort went into vaccine and treatment development for the Zaire strain, which affected West Africa in 2014 to 2016. Trials are underway to determine if they might be effective for this strain, this rare strain. So as with other Ebola outbreaks, healthcare worker infections were among the earliest identified cases. Because aggressive supportive care is currently the only tool in the toolbox, it is even more critical to ensure that health workers are protected. And what makes this outbreak even more concerning is that it is occurring in a region facing numerous challenges: political instability, difficult logistics, an already strained healthcare system, recent foreign aid cuts, which have left the region vulnerable, contact tracing and surveillance remain challenging, and community trust and health worker protection are essential to contain this, but remain challenging. Some experts say that it could take up to 2 years to get this under control.
Okay, just like to ask Danielle now. This is not Afya's first Ebola response. In fact, I was in Afya. I was with Afya in Sierra Leone only weeks before the Ebola outbreak started there in 2014. Can you tell us what we've learned, what Afya's learned from the West African outbreak over a decade ago, and how that experience has shaped the way Afya responds today?
Definitely. So, I think we came out of that experience understanding that protecting healthcare workers is one of the most effective and important ways to stop an outbreak from becoming a larger humanitarian crisis. And I think the previous epidemic taught us that lesson in some of the most devastating ways possible. That outbreak was the deadliest in history. More than 28,000 people were infected, and over 11,000 deaths occurred across Guinea, Liberia, and Sierra Leone. And healthcare workers were amongst the first to fall. Liberia lost 8% of its entire healthcare workforce. Sierra Leone saw a 23% collapse in healthcare services. And those were countries already facing tremendous provider shortages and healthcare delivery challenges. And they lost nearly a quarter of their remaining capacity. So, what this means in a far bigger picture is that when healthcare workers fall, the entire system becomes weak. And when systems weaken, these communities pay an unexpected and I think a really often inhumane price. And the ripple here goes even further. So, when a healthcare system collapses during an Ebola outbreak, people stop seeking treatment for HIV, TB, malaria, maternal care. And as during the previous epidemic, an estimated additional 10,000 plus lives were lost due to other diseases, not Ebola, simply because the healthcare system was now no longer trusted and it was too overwhelmed to function adequately. So there is a sequelae of events that follow this in the sites that are impacted. And in addition to what is happening now, and this was tragically the same last time, all efforts on the ground should include working with local healers and community health workers, not around them. They already have what no outside system could ever fully reach, the trust of their community locally. So you enter these systems of care from a public health perspective and you impose and you shatter the trust. But if you partner, you are able to multiply the benefit and the impact. And I wish this was happening more because I think that is an essential component that is underestimated in terms of its power and its impact. And this is why Afya is only working with folks in healthcare teams on the ground who have been there for a long time. And these teams have people's trust already. And that is a game changer in the process of providing support to the front line. So Afya was there in 2014, and we shipped during that response 124 pallets of PPE and primary care supplies to Sierra Leone. The value was over $600,000, and 82 pallets were sent to Liberia. And back then and now, we had to be really rigorous around who received those supplies. Private individuals came to our warehouse and approached us and wanted to be the recipients of those shipments, and we said no. We made sure that a significant volume of PPE donated to us at the time by Citibank and New York City Health and Hospital Corporation was delivered to the right hands, and that ended up becoming the Ebola treatment units in rural areas who desperately needed these supplies. And so that experience taught us about logistics under severe crisis conditions with challenging custom clearance hurdles that needed to be met. And speed matters, but so does precision. And we built those systems in 2014, and they are what allows us to move so quickly now. And here, PPE is not just protective equipment. In the absence, as Heather mentioned, of an approved vaccine or treatment for the strain of Ebola, it is the medical countermeasure. And it is what stands between a healthcare worker and the virus. And this is the generational impact. When a healthcare worker survives because they had the right protection, they go on to train and invest in the next generation of doctors, nurses, and community health workers. By protecting one health worker, we protect every patient they will treat for the rest of their career. And that is a enormous ripple of impact for what supplies can generate for people on the front line of care. And partners like Regeneron Pharmaceuticals understands this too, and they from day one here have invested in our capacity to respond quickly because they know the infrastructure for response has to exist before the outbreak, not after.
And can
So,
oh, sorry.
please go ahead. Go
I
ahead.
just wanted, Danielle, are you sure you're finished?
Mhm.
Okay, I just wanted to add that, I think it's important to mention that how critical these supplies are now in the face of the changing landscape of funding. So disinvestment in global health security has really made this
Yes.
situation worse. So in particular, in July of 2025, USAID, or the U.S. Agency for International Development, was dismantled. Um, that had led the U.S.'s humanitarian and development efforts since the 1960s. And, you know, the absence of it is having a huge impact in the region. Um, in addition, in January of 2026, the US pulled out of the World Health Organization, recalling personnel, and canceling over $1 billion in annual funding. So many other nations have also drastically reduced their aid budgets. Um, and this has really led to various global health and humanitarian organizations scaling down their operations. And this new era of reduced aid has led to weakened preparedness efforts, and now we're seeing it's hindering response efforts. Overall, there's just fewer experts with fewer resources on the ground doing the work that's needed to prevent this outbreak.
That's certainly true, Heather. I'm going to turn now to David, who's been.
Wait, Dr. Kelly, can I ask you one quick question here?
Sure.
Because because of your clinical work in Uganda, I think it'd
Right.
be really interesting to hear from you what your perception is of what happens to healthcare workers who don't have the equipment they need and aren't protected.
Yeah, I just called yesterday my medical officer at the clinic in Uganda, and he gave me the same stats about there's only two deaths in Kampala and about 80 cases or whatever. But I said to him, well, what kind of preparation do you have? And he said, well, we don't have anything. We don't have any PPE. And so there's really two types of provisions. The PPE that's preventative that people have to have everywhere, just a little bit anyway, and then the PPP in emergencies. And one thing I think that's interesting is there's something called the burn rate, which means that when supplies go to an emergency situation, those PPE may be turning over 18 times a day. Now, can you imagine having to change PPE 18 times a day because of the patients and what you're doing? So that's an amazing thing that people are doing. But diagnosing these infectious diseases, the African people and healthcare providers are very good at it, but sometimes don't have the proper diagnostic tools, as in the case with this virus. And also, it can be confused very often with malaria, and malaria is far more common and actually far more contagious and far more dangerous to the population. So that's what they would initially respond to. One thing that the healthcare workers are very good in contact tracing. In fact, far better than we were during COVID. And they really know how to do things, but unfortunately, they don't have the supplies. So, and many things that Afya does and what I do in the clinic are things ideally that the government should be doing. So we're actually filling in for them, as we're doing now with the United States and USAID and WHO. So that's just my perspective. I'm going to turn now to David, who, again, is the Chief Operations Officer at Afya. Let's talk about some solutions. Many people see supplies arriving in a crisis, but don't understand how that happens. Walk us through Afya's response model, David. Tell us how Afya has launched this emergency response to ensure that the right PPE gets to the right place. Who do you work with and how?
Thank you, Dr. Kelly, and thank you everyone for joining us today. I appreciate the opportunity to let everybody know how we work and how this Ebola response really has mirrored many disasters that Afya responds to over time. The first thing that we do when we learn of a new disaster is make a decision based on a number of criteria. Is this an appropriate response for Afya? Now, in the case of Ebola, there really wasn't much need for discussion given our previous experience, both with Ebola outbreaks and in the region. We knew right away that this was something we were going to pursue. And again, I want to repeat what Danielle had said earlier. In addition, we understood, given the need to protect healthcare workers in the region and that we do have access to quite a bit of PPE, it was an easy decision for us to make. A number of things then happen simultaneously as we're moving forward. One of the most important is identifying partners on the ground that we can work with. Fortunately, again, in this case, because we've worked in this region recently, we had identified partners already in the DRC and in Uganda. And while we are establishing a connection with those partners, we're also looking for potentially new partners that we can work with given the potential scope of this response. So we immediately are in contact with our partners on the ground. We're gathering information, particularly about the supplies that our partners are telling us that are most urgently needed. Afya only ever ships what our partners tell us that we should ship. And as we're doing that, we're also checking through our existing inventory to determine, putting together a packing list to determine what we have that we can ship as soon as possible. Parallel to that, we are also reaching out to our hospital donors. Afya, as you've learned, receives supplies from hospitals throughout New York City and the region. We're a partner of the Greater New York Hospital Association, and working with them, we reach out to all the hospitals in that network, alerting them that we're responding to this outbreak and giving them an idea of what supplies are urgently needed. We've had a really tremendous response in this case. I'd like to flag a few of our partners who have stepped up specifically in response to the need for supplies for Ebola. NYU Langone, New York Presbyterian, Northwell Health, and Stanford Health have all sent us supplies already that we're able to ship. There have been and I should say there are a number of other hospitals that are part of that network that have also reached out to us, and we're in the process of working with them to determine what supplies they might have that we might also include as well. So we're very excited about the response we've gotten from hospitals. Parallel to those, we're immediately talking to freight forwarders. In the case of disaster response, we're fortunate that we work with an organization called Airlink that provides donated air freight for humanitarian responses. We work closely with them. They're an excellent shipper. And I think it's important to understand that in humanitarian events, international shipping has the same requirements as it does for anything. In other words, there are not any shortcuts when we're shipping supplies internationally. There's a certain amount of paperwork we need to fill out. There's export, import, and customs clearance documents that need to be completed. Afya is obviously, we're very familiar with how to do that, and we work with freight forwarders, including Airlink, that really excel in that role, all with the goal of getting supplies overseas as quickly as we can. To date, we've shipped close to 500,000 masks to Uganda, and we have 2 other shipments that we expect to be going out soon that will include another 1 million plus units of different PPE, masks, gloves, face shields, and gowns that we have ready to ship as well. So it really is working through the process with our partners on the ground, with freight forwarders, with our in-kind hospital donors here to continue to bring in the quantity of supplies needed to mount a robust response. And I think, as you've heard today, we expect that this situation, unfortunately, is only going to get worse. So we continue to actively pursue contacts both on the ground and here in New York so that we can continue to maintain a flow of supplies that we'll be able to ship. We learn often in these situations, especially now, that PPE left over from COVID is often available to us. And as long as that hasn't expired, is within the expiration date, a number of our hospital partners have been able to make that available to us as well in this situation. So I think that covers how we work. I will add quickly, Afya, while we're responding to these disasters, is also shipping to other parts of the world. We have other partners who we are working with on a regular basis. And while we're responding, we're also working hard to maintain the work that we're doing to continue to meet the needs of others around the world who we've made commitments to as well. So I appreciate your time today. Thanks. Thanks, Dr. Kelly.
Oh, you're welcome. Okay, at this time, we're all going to give a little vignette, a little distillation of what we think is important or what we want to add on. And I will start. People often ask me, how can they help a nonprofit like Afya? How can they help someone in Africa? I tell them the most effective way is to donate money and supplies. Fortunately, Afya offers opportunities for hands-on volunteering at the warehouse, so you can come and see how your donation is being used. Some people say Africa is so far away, why should I donate when we have so many problems in this country? Afya provides emergency supplies all over the world, especially in United States disasters. In early COVID, I was at Afya helping making protective head coverings. You never know if the supplies you sort may end up protecting you someday. In summary, PPE from Afya is the most effective way to curtail this current Ebola epidemic. We need to stop it before it spreads internationally. I also want you to know that Afya has a 97% rating on Charity Navigator, a level 4. It's the highest rating you can get. So, we're doing such wonderful work that other people aren't able to do, and we need to keep supporting it all the time. So now I'll turn it over to Heather to give her perspective on this.
Thank you. So one of my, concerns with this outbreak is that with prolonged events like this, there tends to be a loss of engagement from the global community over time. And we've seen this happen many times before. So, but I'm hopeful because with the help of our Afya network, we'll do our best to keep it on the radar and give it the attention it needs. And I'm also hopeful because there are vaccines that are being investigated for this. And my final bit of hope is that we have, our first shipment has landed. And we hope to continue to send a steady supply of PPE to protect frontline health workers. Thank you.
Danielle.
Okay, so my background is I'm a clinician. And so what worries me the most is what healthcare workers are facing on the ground right now. They're providing care in absolutely impossible circumstances, and I think the security situation is alarming. Their burial teams have been attacked because of the post-mortem risks. Outbreak community health workers have been taken hostage, falsely accused of spreading the disease. And when the responders are taken hostage, it makes containment incredibly difficult. And so I'm worried about the healthcare system that exists being trusted and better aligned with the community health leaders that people normally turn to. And without that alignment, I think containment really stalls and it is peril filled. I also really believe that PPE is the medical countermeasure for our colleagues there. It's the only thing now that stands between a healthcare worker and this virus. And I think, the other counterpart to that is what gives me hope, genuine hope, is our partners. There are hospitals in the greater New York hospital system that are partnering with us and donating supplies. And the beauty of this work is that these supplies are coming from our hospitals. These supplies would have been discarded for a myriad of reasons, and instead they're being donated and they're going on to have a second life as they should. And I'm absolutely blown away by the frontline healthcare workers in DRC and Uganda and the community we have here, especially because you care enough to be here. And the reality is, outbreaks are contained by people, and we can all act to do something about this outbreak.
I think this time, Liz, are there any questions that the audience has brought into the chat? I don't see them. Oh, let me see here. Maybe they are here.
Sorry, I can add a thought, Dr. Kelly, and I just as a final word, if I may. I mean, I think from my perspective, and in terms of this response, we've seen a great response from our hospital partners, as we've said in New York. It's really critical to our being able to respond. I also would be remiss if I didn't give a shout out to our warehouse team at Afya. We really have a great team, and I think, as I mentioned before, the ability to respond to such a large outbreak and to create a flow of supplies while we're also managing other shipments to other parts of the world. It really wouldn't happen without our team at Afya, and that gives me a great deal of hope that we'll be able to continue to respond strongly to the Ebola outbreak. So thanks.
I have a question here from Awok Derby. Thank you for the talk. How are humanitarian and health agencies managing the response in high-risk zones facing conflict and population displacement? That's a tough one.
Well, I think without claiming to know exactly just from previous experience in these environments, it is one of the problems. I think, as Heather noted earlier, that insecurity really does create an opportunity for the virus. So the monitoring, providing support and healthcare really is limited, and aid organizations need to be very careful not putting more people at risk while trying to provide support. So it's a good question. I think it's a significant challenge for organizations on the ground to operate in this kind of an environment, and important that we recognize the challenges they face in trying to do so.
David, Grace Denfield wanted to know, how do the shipments arrive? By plane, boat, or how else?
So right now we're entirely focused on air freight. As soon as we can get the supplies onto planes, they can arrive there within 2 or 3 days. Because, again, we expect this to be, unfortunately, a longer drawn-out response, we're also starting to look at ocean freight options. It does, of course, take longer for container to get there. In this case, it needs to go to a port probably in East Africa and then travel overland to get to the affected areas. But because we anticipate that this is going to go on for some time, we're looking at trying to get containers onto ships soon, because we know those supplies will still be needed when they arrive.
She also wants to know, how long does it take to distribute the items once they're on the ground, and where are they stored and protected?
Another great question. So it's important for Afya, as we identify partners to work with on the ground, not only in this case that they've got established roots in these communities and including with the healthcare system, but they have a logistics capacity, which includes access to warehouse or storage space, initially just to receive the supplies, but then from which to send the supplies to the affected areas, to clinics where they're providing support to healthcare workers. So that's always one of the important questions that we dig into with our partners on the ground when it comes time to create shipments.
Another question is, this will be for Danielle. What is your greatest organizational need here in the U.S.? More hospital collaboration, space, money, etc.
Dan, thank you for that question. So let me say two things here. One is anyone who has any connections to hospitals that could donate PPE to this effort, that is something that is needed. And we would love that connection and that introduction. And this response effort at the scale that we are engaging in definitely needs funding and additional funding support in order to be able to enact the change we want to see. And we want to keep a steady stream of PPE going. The worst thing is to begin and not to be able to see it through. So this is something we are committed to raising funds for, so that we can be the site that some of these providers, as Dr. Kelly said, if they don't have PPE, we are looking at a complete demolition of healthcare and healthcare providers in these areas.
All right, so at this time, I want to thank Heather and David and Danielle for helping us better understand both the challenges of this outbreak and the importance of supporting healthcare workers on the front lines. Most importantly, I want to thank everyone who has joined us today. It's your interest, engagement, and support that will make a difference and improve the rapid humanitarian response that we need. Healthcare workers in Uganda, the Dominican Republic, and all around the world depend on strong partnerships, reliable supply chains, and organizations that can act quickly when emergencies arise. Afya has demonstrated that they can do all of these things and do them the best that anyone does at this time. We are grateful that you took the time to be part of this conversation, and we encourage you to stay engaged as this response continues. Some final closing words, Danielle?
I want to thank everyone for being here, first of all, with us today, and you, Dr. Kelly, always, always. I think the healthcare workers need our support right now, and we are highly committed to teams on the ground in both DRC and Uganda, and making sure they have an ear and they have a place to go for what they need, and they don't feel stranded out there without support. And so I want to ask everyone three things before you go. Please stay engaged. This response is going to take time. And as Heather mentioned earlier, sustained attention and investment matters. Share what you learned here today with your networks. There's going to be a link to this video on YouTube. Please share it. The more support we can garner around this, the better. If anyone knows anyone who has access to resources or folks on the ground who are in need of help, please connect us. And if you are in the position to give, please do, because every dollar we receive right now is going to help us help these frontline healthcare workers who, and the beauty of this town hall is that they have no idea how hard people are advocating for them, and they deserve it. And so, in doing so on their behalf, we protect all. And just thank you all for being with us and for being a part of the Afya community.
Thank you, Danielle.
I think that concludes our session for today then. Thank you again, everyone, for being here. And if you would like to follow up afterwards, just feel free to reach out to us. Thank you.